for this webinar on coordinated assessment and assessment tools. My name is Kim Walker, and presenting with me today is Norm Suchar. We're both with the Alliance's Center for Capacity Building, which is the technical assistance arm of the National Alliance to End Homelessness. We also have today Anna Blasco, who's going to be helping out with asking some questions toward the end of today's webinar, and also answering any kind of technical questions you have about audio throughout the webinar itself. So the usual reminders, and these will be very familiar if you have listened into one of our webinars before. Today's webinar is going to last 1 hour, right around there. All of the participants on the call who aren't one of us at the Alliance are muted because we do have so many people listening in today. The webinar is being recorded and will be posted to our Coordinated Assessment Toolkit, which is, if you're not familiar, a resource on our website that has a lot of papers about coordinated assessment, sample tools that we've gotten from different communities and that we've created ourselves. If you haven't located that before, don't worry. We'll be sending out the link to that toolkit to everybody that registered for today's webinar after it's over. We will be taking questions today at the end of today's session. If you do have a question at any time during the webinar, go ahead and enter it into the little box at the bottom that says either questions or chat. Anna will then filter through those and we'll address some of them at the end of today's session. We won't be able to get to everybody's questions because we do have so many people listening in, but we may follow up if there's a particular question that comes up a lot or that we think warrants more review. We may do a blog post or an additional webinar on it, or even maybe cover it at one of our annual conferences. The agenda for today, I'm going to start out with just a very brief review of what coordinated assessment is, just to make sure we're all on the same page, and then dig a little bit deeper into the assessment phase, which is our main topic of discussion today. And then I'll be turning things over to Norm to talk about assessment tools. So we'll talk about how you can figure out which tools are right for your system, as well as some of the pros and cons of different tools we see being used around the country. And as I mentioned, we'll be saving some questions for the very end of today's session. So what exactly are we talking about today when we say coordinated assessment? This is the definition of coordinated assessment that was included in the interim continuum of care rule or regulations, and we've shared this with people before, I know. We've underlined here what are really the most important parts. But the important thing to remember is that essentially coordinated assessment is meant to make it easier for people experiencing homelessness or at risk of homelessness to access needed services. And so as you see underlined here, that includes doing assessment and providing referrals, as well as program intake when that's appropriate, and also developing a process that covers a specific geographic area. So that may be a county, a continuum of care, a city, it might be a whole state in some places. And again, you want something that's easy for people to access, is well advertised, so well known, and includes a comprehensive and standardized assessment tool. And the assessment tool piece is something we'll be focusing on today. Beyond kind of the technical terms and technical aspects of defining coordinated assessment, what this process is also really about at its heart is easing the burden on people experiencing homelessness. So I think a lot of people in this field, we've heard kind of crazy stories, the lengths that some people have had to go to in order to access a shelter bed or get whatever resource they needed when they became homeless. A coordinated assessment system through a more efficient entry process, better informed referrals, which I'll talk about more in just a minute, and more coordination between programs should make it easier for people to avoid situations like these. Calling every day to the same program to see if their bed's opened up, program hopping until they get to the program that can help them, finding out about something that could have helped them months ago too late, et cetera, et cetera. So these are the key elements of a coordinated assessment process as we see it. And again, today we'll only really be talking in depth about the standardized assessment piece, but I did just kind of want to briefly review some of these other pieces, just again, so we're all kind of thinking about the same process here. As far as a safe and accessible location, every coordinated assessment process should include at least one safe, accessible place where people can go to get assistance. In some places, it may be multiple places. Ideally, as we mentioned in the HUD definition, those locations are well known and well advertised, but it's also important that communities ensure there are safe locations available for survivors of domestic violence or victims of stalking, et cetera, who might need more discreet or private options to preserve their safety. This can be accomplished through a telephone line, which is something a lot of communities incorporate into their approach, or having a domestic violence agency be one of the locations that does the coordinated assessment. But that's definitely something to keep in mind when deciding on those locations. For data collection and management, you want to make sure that you're collecting data that's consistent with HUD requirements, so making sure you're capturing the right data elements, and again, looking out for the confidentiality and privacy of people accessing the system. You should also be collecting information that will be useful in helping you understand the performance of your coordinated assessment process. So if you're wondering kind of what those elements might be, we do have some evaluation tools in our coordinated assessment toolkit that can kind of point you in the right direction. As far as referrals go, you want to make sure that when you're making a referral, it's taking into account bed or unit availability, consumer need as expressed by them, which is something else we'll talk about a little bit later, individual program services and specialties. So we know that the providers in one community may have different areas of expertise, and that's certainly something you want to be thinking about, and local outcome data. So looking at who's been successful in the program before, how the program is designed. You want to be thinking about all of those things when you're making a referral. And the last piece here, I think, is it's not so much a tangible thing maybe, but it's really thinking about system change. So I think a lot of the reason we implement coordinated assessment, it might be because it's required. It's definitely because it's making it easier for people to access our services. But it can also really help improve your system overall as a whole. And so if you add coordinated assessment to kind of system-wide collaboration between providers, if you look at aligning what programs are doing with the overall goals of your system, which may be expressed through a 10-year plan or some other document like that, if you're really focused on aligning your front-end and back-end resources, so making sure that the resources you have available for people are the ones that people need the most, and if you have some kind of centralized authority that's really enforcing your prioritization and targeting standards across the community, those things are what are really going to help you achieve an effective coordinated assessment process and an effective homeless assistance system. And if that was, I know that was a lot of things at once, so we will also include the notes with this PowerPoint if you want to read over that list again. So let's talk about what happens in the assessment phase of the coordinated assessment process, which is what we'll be focusing on today. This is just a definition that we came up with, which is that this is the phase used to gather information needed to determine the best immediate next step for a person experiencing homelessness or at risk of homelessness that will help them get back into permanent housing. And I would even say there it will just help them resolve their housing crisis. And I think, again, this phase is about getting information, but really getting targeted information. And I think that's something that will come out in the later slides, what information you need to gather and why. But it's important that you're linking all of that information to figuring out the referral that you need to make. And I want to point out something that's not in this definition, and that's on purpose, which is that this is the phase where you capture all the possible information you can about your client. That's something that's not necessary at any point in the assessment process or at all in your system, really. And it's really important that as a community you talk about the difference between what's necessary to help the client connect to the right program or housing resource, what might be helpful for a client's case manager to know once they have been assigned to a program, and what information is just kind of unnecessary and intrusive to gather. So the first set of questions is really the only set you need to worry about at the system level. And the second set, which is things that might be useful for a case manager, are probably best left to the program. And I know different tools deal with that a different way, but you definitely want to make sure that you're not duplicating the questions you ask at the system and at the program level. And I will say it takes a little while to kind of find that balance between those questions. I do think if you take a hard look at assessment tools, you can figure out, wait, are we just asking this because we think it's important or because it's linked to a program requirement or something like that? I think you can pretty easily eliminate those things in Category 3, but it does take a little bit of time, and generally speaking, I think the best thing to do is just to start by asking as few questions as possible. And this is something we'll be talking about throughout the webinar today. So as far as managing expectations about your assessment phase, it's important to remember that this is only one stage in your coordinated assessment process. So before we talk more about what exactly that should be doing, it's, I think, really important to know what you shouldn't expect to come out of this. And the first thing we have listed here is that you're going to get perfect information. Often people that are coming to us for help are in a state of crisis. They won't always be able or willing to give you all of the information you're asking for, especially if right now your system is set up where you're asking a lot of questions up front. In some cases, you may find out, and this certainly happens everywhere, that more information became available later. The person shared something with you after they'd already been assessed and referred. And I think you kind of have to expect that to happen. And if that's the case, all you can do is decide if that information does change the referral and kind of correct that. But again, I don't think you should expect that within a few hours or even a few days of someone accessing your system that you're going to know everything you need to know about them as far as housing information that you need necessarily. And again, part of that is on us as providers and people in the field to make sure we're not asking too much of people up front. As far as the change an assessment phase can have on your system or the effect it can have, a tool alone isn't going to change how your system behaves or performs when it comes to helping people get rehoused. You can, however, use information you get from your assessment phase and figure out if you need to reshape your system or add or subtract things from your community. So I know one thing we have built into one of the assessment tools that we've developed is a primary assessment and a secondary assessment. It's basically just a space on your tool where you can write, okay, well, this person should have gotten this intervention or gone to this program, but since that was full, we referred them to this other program. And even something basic like that can give you an idea of, wow, we have a lot of people that need this resource, but we don't have it. And so we certainly encourage you to do this. You should use that information to kind of figure out what you need more or less of in your system. But just having the information alone is not going to make that change for you. And also, just to speak to a point that we've had other people talk to us about quite a bit that have implemented coordinated assessment, is that I think a lot of times we get caught up in asking the right questions and exactly how many questions, and you certainly want to think about those things. But again, overall, your assessment tool and even the assessment phase is not necessarily the most important part of your coordinated assessment process. Making referrals is important. Just having your programs be accessible is really, really important. So I think every community should keep in mind that the key here to the success of your coordinated assessment is that you have programs and resources available for the range of people experiencing homelessness, that people can get into those programs, so really looking at your program requirements, and again, using outcome data and feedback about your process to make it better. I think that alignment, again, of front-end and back-end resources is really the key to success here. So now let's just kind of break it down into some basic elements of what a good assessment phase has. And from our view, a good assessment phase should be tiered, so have kind of multiple levels. It should be consistent, and it should include some elements of consumer choice. And again, this is just talking about the assessment phase generally. Norm is going to talk more about specific tools. So when we say tiered, again, we mean there should be multiple levels to your process. We think that tiering your assessment process by dividing things up a little bit into different phases over a week or more, 2 weeks even, can ensure that you're giving a person that's homeless every possible opportunity to succeed and exit the system positively with as little intervention as possible, which is really ideal. And it's also a way on the other side of things to reduce the amount of staff time you're investing unnecessarily in assessment. So to start out with, we think every community should begin with a brief prevention or diversion screen. This might be, just 5 or 6 questions, and we certainly have samples of these on our website, and I know Norm will talk about a few later on. This is really to figure out if there are other safe options for the household outside of the homeless assistance system, or ones that they could get back into with a little bit of conflict mediation between them and the other tenant, or between them and their landlord, or some short-term financial assistance. So some examples of what you might ask on a screen like this might be, where did you stay last night? Why did you have to leave? Again, uncovering if this is something that could be solved with some mediation or a little bit of money. If we can't house you, where will you stay tonight? So kind of helping people think through what other options might exist. We found that we hear back from a lot of communities that have done diversion at a more system-wide level that they're able to divert about 20 to 30% of households, mostly families, from entering shelter at all, and divert them into safe locations, which is the key. We certainly don't want to turn people away that need that shelter bed. If you're not kind of starting out with a screen like this before doing any other type of screen, you really are losing an opportunity to ensure that your shelter beds are available for the most vulnerable people in your community, and to help other people just stay out of the system entirely, which I think is ideal for most people. So another thing to think about is your housing barrier assessment. And so I know communities do this some different ways. Some do a prevention diversion screen, and if that's not an option, very clearly immediately follow up with the housing barrier assessment. And some communities wait maybe a week or 2 after a household has gotten into shelter to do this. So we do know that there are a lot of people that enter emergency shelter and find a way out without our assistance, without any staff assistance or financial assistance. So again, we do want to give people an opportunity to exit on their own if that's possible. But again, we have seen this done kind of multiple ways, and so we don't really have a right answer in terms of where this should happen. But this assessment is going to get more into the barriers a person has to getting back into housing, or that may have led them to be kicked out of their previous housing if that was the situation. So this will look more at income, rental history, criminal history, etc. The answers to those questions are going to help generate a referral to a program or a resource or a housing unit outside of shelter. So again, that's not, if someone can be diverted, I don't think you need to get to this phase at all. But if it's clear that after that someone might need more assistance, again, some communities jump to this right away. Others will let the person enter shelter, wait a few days, a week, 2 weeks, and then ask these questions to, again, kind of maximize opportunities for that person to solve their crisis on their own. And finally, we have the permanent supportive housing prioritization assessment. So in some cases, we'll have people that are entering the system from a state of chronic homelessness or on the street or somewhere else not meant for human habitation. And in those cases, it's probably appropriate to just do this kind of assessment right away. Where someone's been on the street for years, diversion probably not an option. And this might also be something you consider for people that have gone through the system before a number of times and have been unable to stay stably rehoused. So again, this is something that's happening over a certain period of time. It's not all happening at once. And we really feel strongly that you should be giving people that opportunity to figure things out on their own and look at that as a good thing if they do. But again, you want to think about when you're adopting a certain tool or set of tools, how those kind of slot into these different categories. The second big tenet we mentioned at the beginning was that your process should be consistent. And that's not just that your tools should be consistent, which is kind of required by having that whole standardized assessment piece, but also that they should be administered in a consistent way. So I know some communities have a scoring process that they use with their tools to determine what referral is made. Some people rely on their staff to make that decision kind of based on the training they've received. In either case, you want to make sure that there's still a basic understanding of what makes them appropriate. Some referrals more appropriate than others, especially if you're just using kind of the judgment of trained staff. And of course, part of that training should include, this is what our prioritization standards say and our eligibility standards say are the right referrals to make for certain people. Along with that, you want to have written procedures that lay out when and how tools are administered and by and to whom. Obviously, if you have written procedures that will help people, especially if you're tiering things, to make sure that they know when each tool should be administered. Obviously, if you have staff turnover, you want to make sure it's clear to everybody. You do the diversion screen first, then you move on to this tool or that tool. But just having that in writing and making sure that everyone kind of has the same process, that's especially important if you have multiple coordinated assessment locations across your community. You also want to include in any written procedures when you enter data into HMIS. So it might be that you entered it from the very beginning, which is great. But again, no matter what the answer to that is, you want to make sure it's clear to people what gets entered into HMIS and when. And finally, you want to make sure that your staff are trained in administering the tools and interpreting results. So again, there might be a very simple scoring process, so it's just using that number to figure out what comes next. But no matter how your system works, you want to make sure your staff understand the tools and really the purpose of the tools, not just reading the questions, but knowing this is meant to get a sense if this person has any other options outside of shelter, for example. And the last piece I wanted to mention is about consumer choice, or choice for the person experiencing homelessness. When someone comes to you in a state of housing crisis, sometimes our automatic desire is to say, okay, we just want to get you to the right place right away, and we don't necessarily give them the space to tell us what they need. And people experiencing homelessness often know what's most helpful for them to get back into housing. We've done a lot of surveys at the Alliance, probably across 40 or 50 communities at this point, through our performance improvement clinics, where we've asked people experiencing homelessness, what did you need the most to get back into housing? And usually the answer to that question is rental assistance. And then when we ask them, what were you offered, unfortunately, that's not always the most common answer. So in thinking about that and just thinking about the fact that this is this person's, this is where they'll be living or staying for a while, you want to make sure that you're giving them some input into the process. So one way to do that is to use the results of your assessment scoring system and offering choices between several different options that appear to fit well. So for example, if your process says, rapid rehousing would be the best choice, transitional housing would be the second best choice, telling them that and then telling them up front, okay, this is what you can expect in a rapid rehousing program. This is how the model works. This is how long you probably have to wait to get into the program if there is a wait list. And this is how long people typically stay in these programs before they move on to their own housing. That's all information we want them to have and to be able to think through. And so you could offer them those options between kind of maybe the top 2 or 3 choices, talk those through, and then allow them to tell you what they think would be the best place for them. And I really want to stress here, again, there's a lot of different ways to do this, but we don't want a system that's not looking at a need or a want or whatever the case may be of someone experiencing homelessness. The real point of coordinated assessment is to make sure their needs are met. So we certainly want to take the time to ask them what those needs are. So with that being said, I'm going to go ahead and turn things over to Norm to talk more in detail about assessment tools. So Norm?
Thank you very much, Kim. So, and welcome everybody. So I'm going to talk about some of the assessment tools that are out there that I think people have heard about, and some of the sort of appropriate uses of each one, and some of their strengths and weaknesses, and also talk about sort of what the purpose of assessment tools and assessment questions is, and what are the kinds of things that you can reasonably assess, and things that we really can't assess at this point in time. And one thing I just want to stress is that there are a lot of communities where people are developing their own assessment tools, and I think developing very, very good assessment tools. And it's certainly something that you can do. But it's not something you have to do. There are certainly tools out there, and there's probably a combination of tools that can work for your community. So let me start by talking about some of the various things that you can assess for in general. So certainly you can assess for the risk of becoming homeless. This is something that's very challenging to do, and we don't have tools that do it really well at this point, but there are certainly communities that are starting to do a better job of assessing risk of becoming homelessness. becoming homeless. You can assess the risk of remaining homeless, and this is something I think we're getting a little better at. And so this is where you probably want to put a lot of your energy, because if it comes to reducing the numbers of people experiencing homelessness, people who have a likelihood of remaining homeless for a long time certainly should be the target of our efforts. You can assess for the different housing options that people have, and both the support networks that they can take advantage of, and other housing options that they might have. You can assess for different kinds of vulnerability to homelessness, so either vulnerability through health and medical needs, and the degree to which people are going to suffer more health problems because of homelessness than other people, or vulnerability to domestic violence or other kinds of violence, or vulnerability to other things. You can assess for self-sufficiency, and this is something a lot of people try to do. Assess for people's service needs, assess for people's health status and health needs, assess for domestic violence risk, assess for income and education needs. You can assess or ask about the things needed to fill out HMIS, the universal data elements and other data elements that you need to make entries into HMIS, and you can certainly assess for people's program eligibility. But that's different than what you should assess for in the coordinated assessment process. So of all the various things that you can assess for, and there are certainly even more than I had on that list, the really important things to assess for during a coordinated assessment process are these first few. You really want to assess for the risk of becoming homeless, and this is something Kim talked about, that you, if at all possible, want to assess the opportunities for diversion from homelessness. So if there are safe, appropriate options, alternatives to shelter, you want to take advantage of those. So that's something you can and ideally should assess for. You want to assess for the risk of remaining homeless, because again, we want homeless episodes to be as brief as possible. So identifying those people who are most at risk of remaining homeless for a long time is very important. You want to assess for the available housing options or the housing opportunities that people have, because that can be an important pathway out of homelessness. And you do want to assess the vulnerability to homelessness, especially the degree to which people are at very imminent risk just from being homeless. This certainly happens for people who are surviving domestic violence, people with serious medical conditions, with substance use disorders, and you know, other people, youth vulnerable to sexual exploitation and things like that. So as you're thinking about what kinds of things you want to be able to assess for, these first few are really important. Now the things that, there's this other category of things that we wish that an assessment tool could assess, but so far we haven't been able to find an assessment tool that can do that for us well. And the one thing I think most people want to use assessment tools for is to identify who will and won't succeed in a particular program. And it turns out that this is not something that assessment tools do very well. For the most part, you know, people can succeed or not succeed in a program, but the reason you want to prioritize them for participation in that program is because of those other factors we talked about earlier. To what degree are they vulnerable from homelessness? To what degree are they going to experience a continuing episode of homelessness? And that's the main way you want to prioritize. The degree to which we can identify when a person won't succeed in a program and thus you know, try to screen them out for that reason, that's not a good strategy, and it's probably something you shouldn't be expecting that your assessment tools can do for you. The other thing assessment tools cannot do, at least by themselves, and this is something Kim was alluding to, is to help you determine how much of particular interventions that you need in your community. The assessment tool can certainly give you supporting data for that, but you'll have to really analyze a lot of the other data in your system, the outcome data, especially from things like your AHAR and your HMIS system to be able to get that kind of information. So what's the point of an assessment tool? So assessment tools could do a lot of different things for you. And in the next slide, I'll talk about the things they should be doing as a high priority. But these are all the various things they can potentially do for you. They can help you identify who to prioritize for prevention assistance, looking at those people most likely to become homeless. They can help you prioritize homelessness diversion, looking at those people who have the housing options that might succeed in a short period of time. They can help you, if you're in a community where there aren't enough shelter beds for everyone, it can help you prioritize your shelter resources by prioritizing people who are most vulnerable to sleeping outside or from sleeping outside. It can help you prioritize your rapid rehousing assistance, your transitional housing assistance, and your permanent supportive housing assistance. Rapid rehousing and transitional housing prioritized for people likely to remain homeless for a long time, and permanent supportive housing often prioritized for both long homeless people who might experience long homeless days and also for people with a high level of vulnerability of some sort. Assessment tools can also help you create a housing plan for an individual or family. They can help you create service plans. They can help you evaluate client progress over the course of your work with them or over the course of their experience in the homeless system. And they can help you evaluate program performance as well. And all of these assessments are assessments that somebody should be doing at some point. But looking at just the types of assessments that should be done as part of the coordinated assessment process, it's really these first 6 here that are you'll want to have happen during that coordinated assessment process. The prevention, diversion, shelter, rapid rehousing, transitional housing, and permanent supportive housing prioritization. So you'll see that the common thread through all those is this is really about identifying who should be prioritized for various kinds of assistance, not who it's going to work for or who it's not going to work for. In general, if the program isn't going to work for a certain type of person, it's likely that it's the program that probably needs some modification rather than trying to assess people to fit the program model. So this leads to 2 different things that we're calling tool rules, assessment tool rules. So the first sort of rule, and this isn't obviously an official rule, this is sort of a guideline that we like to use here at the Alliance. But the first tool rule is that an assessment tool should include a question only if the answer to that question is needed right then to determine what kind of assistance a person will receive. There's certainly there's more kinds of assessment that you'll want to do. You'll certainly want to assess client progress. You'll want to assess them for their housing plan and service needs. But these are not things that need to be done at the coordinated assessment during the coordinated assessment process necessarily. The process of doing those kinds of assessments for service needs and things like that help build a trusting relationship between a caseworker or other professional and the client. And the coordinated assessment process isn't really about developing relationships. The coordinated assessment process is really about triage and helping people connect with the resource that's going to be their more long-term support as quickly as possible or at the appropriate time. So what I strongly encourage people to do if they're looking through coordinated assessment tools is look at all the questions and ask yourself, is this going to make a difference as to where this person needs to be placed or referred to right away? And if not, can we remove that question? Rule number 2 is that, and this is also something we've seen commonly in communities that develop coordinated assessment processes, and it leads them to reevaluate their assessment process. And that is that if an assessment tool is resulting in so many referrals to a program that it causes long waiting lists, then the tool should probably be modified. Waiting lists are really sort of the enemy of good performance in the homeless assistance world. What we want is for people to, if they need an intervention, to get it quickly, and if they don't need an intervention, or if they're a lower priority for an intervention, that they're working on trying to find other ways to get housing, rather than staying on waiting lists for a long period of time. Now, if it turns out that people weren't referred to a program and continue to be homeless for a long period of time, then you'll certainly want to reevaluate your initial assessments, periodically, to make sure that people don't just, because you didn't catch something right away, they don't sort of get mired in the homeless system. But if you're starting to see long waiting lists, then it's probably time to go back and, if not change the assessment tool, at least reestablish benchmarks so that the number of people being referred to programs is consistent with a shorter waiting list. So with that, I want to talk about some of the various tools that are out there. We certainly are not going to talk about all of the tools. We're going to talk about some of the more common ones, and also some that don't get talked about as much but probably should be. And let me just say, there's no right or wrong answer. People often ask us about, is this a good tool or not? And what I really want to stress is that the context is very important, and how you use the tool is extremely important. So let me start by talking about the vulnerability index. So this is a tool used by Community Solutions. I think probably many of the people on the call are familiar with the vulnerability index. So some of the things that the vulnerability index is good for, as its name implies, it's a good tool for assessing vulnerability, and very specifically vulnerability to death. And it's a good tool for prioritizing for permanent supportive housing. What the vulnerability index doesn't do well is it doesn't really assess people's housing options, and it's not really a great tool for prioritizing for other interventions. For prioritizing for rapid rehousing and transitional housing, you really want to take a look at people's risk of continuing to remain homeless, and that's something that the vulnerability index really wasn't designed to do. So another tool that I think is sort of gaining popularity, and a lot of people are starting to hear about, is something called the SPDAT. SPDAT, in case you're interested, stands for Service Prioritization Decision Assessment Assistance Tool. Sorry, Service Prioritization Decision Assistance Tool. There are multiple versions of the SPDAT that are out there. There's one for sort of geared towards single adults, and that's actually been modified also, so there are a couple of versions of that. There's a version for families that's quite a bit different. So there are different versions of the SPDAT. For those of you who aren't familiar, I'll give a brief description of it, but the SPDAT looks at multiple domains. For example, people's housing status, people's health status, people's income status, self-care, things like that, and provide sort of a few different options, 5 options that you can choose from to determine by selecting which one best describes the situation the person is in, and it sort of gives you, totals all that up and gives you a total score. What the SPDAT does a nice job of and is good for is, like the vulnerability index, it does a good job of assessing vulnerability. More so than the vulnerability index, helps assess service needs. It's a good tool for prioritizing for permanent supportive housing. And one thing that the SPDAT was very consciously designed to help do is to evaluate client progress. So this is not a tool that is intended to be used only at the coordinated assessment process. This is really a tool that's designed to be used sort of, at the beginning and then for reevaluations of a client's progress. The tool doesn't do a great job of assessing people's housing options, and this is where one of the rules comes in. I think you really have to be careful about using the tool because it's a lot more information than you need unless you plan on using the tool as a sort of a case management tool and using it over and over with a client to do, follow-up evaluations. So just something you have to be careful with if you're planning to use that SPDAT tool. So the next tool we'll talk about it doesn't really have a specific name, but this is the Diversion Tool used in Canton, Ohio. This is something we have on our website, and as our sort of description of it implies, it's a tool to assess housing options and to assess the possibility of homelessness diversion. I will say if you're looking for a good diversion screening tool, I would certainly look at this and pick out the questions that work for your community and the clients you work with, because it is a very nice, simple tool. Doesn't really help you prioritize for other interventions like shelter, rapid rehousing, transitional, and permanent supportive housing, though. But it is a great diversion screening tool. So the next tool, and again, this doesn't really have a title, but Hennepin County, Minnesota is a community that has a long history of rapid rehousing assistance, especially to families. Hennepin is the county that includes Minneapolis, Minnesota. So they have a long history, and they've sort of evolved this housing barrier tool, housing barrier assessment, and many other communities have sort of taken that tool and made some modifications to it. So there are numerous sort of customized iterations of this tool, and we have one version in our, we have a guidebook to rapid rehousing, and so we have one version in there, but there isn't sort of one standard tool. There are sort of a lot of different versions that have been customized and are being used differently by different communities. And one thing the tool does nicely is it's really focused on assessing for the risk of continued homelessness, really focuses on basically the barriers that households have to getting into rental housing. One thing that it really wasn't designed to do and doesn't do is assess for vulnerability and things like that. So it may not be the tool you'd want to use, or at least not by itself, to assess for permanent supportive housing for individuals experiencing chronic homelessness, for example. But it does a very nice job of assessing for the risk of continued homelessness. Another one I want to talk about is the Arizona Self-Sufficiency Matrix. So this tool has been around a while, and I think a lot of people have at least seen parts of it or have seen it because it's integrated into many homeless management information system implementations. The Arizona Self-Sufficiency Matrix looks a lot, for those of you who aren't familiar with it, looks similar to the SPDAT tool in that it covers several domains, and then you have sort of several answer categories in each domain to select sort of what family's situation is. The domains are, again, similar to the SPDAT. There are some on, for example, child care and employment and things like that, as well as housing status. The Arizona Self-Sufficiency Matrix was developed, obviously, in Arizona, and was developed to evaluate client progress, initially developed to evaluate client progress in a in sort of a joint homelessness and self-sufficiency program. So there's really a lot more emphasis on the self-sufficiency aspects and the employment aspects than there would be if it was just strictly a tool focused on ending homelessness. So again, the things it does well is it assesses for self-sufficiency, service needs. It's certainly a good tool for evaluating client progress. It doesn't really give you do much to help assess for housing options. It is a more extensive assessment. You're going to be asking more questions than you would normally ask in a coordinated assessment because the tool is focused on self-sufficiency in addition to homelessness. And just sort of one caution I would give, and one thing I think you really have to focus on when you're using some of these tools like the SPDAT or the Arizona Self-Sufficiency Matrix, that they're not necessarily just focused on the housing and homelessness aspects of a person's situation. And so something you, I think, have to be really careful of in thinking about what the purpose of your homeless assistance program or system is, and if it is something where you have a big mainstream engagement to help with self-sufficiency or employment or something like that, then some of those aspects can be really useful. Or if you're you're tracking client progress over a long period of time on a number of dimensions and you're not just concerned about housing and homelessness, then these tools can be useful and interesting. But they do sort of take the focus away from just housing and homelessness, and it's something you have to be, I think, cautious about and careful about. The last tool I want to talk about is one that the National Alliance to End Homelessness. We did some work with Prince George's County, Maryland, on an assessment tool, and we don't have this up on the website yet, but we'll put it up in the next few days and send the link out to people. But the tool is a very basic tool, and we tried to incorporate some of the things that that we liked in other assessment tools. It asks a few simple questions about homelessness history, previous episodes of homelessness, and some of the major housing barriers, just a few of the very major housing barriers. And the one thing, so it does a pretty good job of assessing for risk of continued homelessness. I think it's a good tool about if you're looking to prioritize rapid rehousing and transitional housing resources. And the tool was very consciously designed to minimize the length of waiting lists. So one of the factors that enters into the tool is the current waiting list for programs. And as the waiting lists get longer, the amount of people that the tool refers to the intervention gets smaller. And as the waiting list gets smaller, then it sort of refers more people to that intervention. So that tool rule 2 was the one about if your tool is generating long waiting lists, then you should be modifying the tool. This one sort of has a process to modify that on an ongoing basis. That tool, however, does not help assess for vulnerability, and it wouldn't be a tool, or it wouldn't be the only tool you would use to prioritize for permanent supportive housing, especially for single adults. So those are the sort of major assessment tools that we're going to go through on this call. Just want to say a few words about using assessment tools before we get to your questions. The one thing that I think in our experience working with communities on assessment tools, the one thing I think is pretty clear is that you really need to think about combinations of tools depending on how your homeless assistance system is designed. And expecting sort of to have one tool and do one assessment at one time is really not going to be a workable situation, and it's probably not the best for people you're serving as well. So looking at piecing together, for example, things like the diversion tool from Canton, a housing barrier assessment from Hennepin County, or the one the Alliance in Prince George's County developed, And then for people who, score for needing more intensive interventions or need permanent supportive housing or things like that, to then, just for that group, to use one of the more vulnerability-focused assessment tools like the SPDAT or the Vulnerability Index is, I think, a good strategy. Another strategy is that I know the SPDAT tool also has what's called a pre-screen, which is sort of a mini assessment that can help you determine whether somebody's going to need the full assessment. So, a lot of options out there, a lot of things to consider. We certainly don't expect to be able to give you the answer. I wish we could, but the answer in just a 1-hour webinar. But we're certainly happy to talk you and your community through some assessment tool options and, what we think are helpful ways to think about how you should use tools. And the other last thing I'll say is that people are just constantly coming up with new tools or new versions of tools. For example, the group community solutions and the people who work on the SPDAT tool have created a combined vulnerability index and SPDAT tool. And many other communities have developed tools as well, and I will say I've been very impressed with some of them. So if you have a tool or you notice a tool that you think it would be helpful for us to know about, by all means, please send it our way. So with that, I'm going to turn it over to Anna to see if we have any questions for us on the webinar so far.
Yes, we have lots of questions. So we're only going to get to a couple of them probably because we have limited time. So I'm going to ask the questions of our attendees, our speakers, who I've seen a lot of people ask the same question. So we'll start with a very simple one. How can people find the tools that you've discussed on the webinar today?
So I can answer that. So a lot of them are in our coordinated assessment toolkit, which is on our website. And so what we'll do is send out a link to that toolkit to everyone that's registered through the GoToWebinar software. And as Norm mentioned, the Prince George's County tool isn't available yet, but will be. As for the SPDAT and the Vulnerability Index, we can send out kind of contact or website links to people that want to connect with them, those organizations.
We had a lot of questions about the SPDAT. You said that it wasn't good for assessing housing options. Could you explain this a little bit more?
Well, so I think the tool that does a good job of assessing housing options is really the Canton Diversion Assessment Tool, which really asks direct questions about different housing alternatives that might be available for a person, whether they have friends or family or support networks they could take advantage of, and things like that. So again, it's not the SPDAT tool was really intended to focus on people who have pretty long histories of homelessness and for whom the homeless assistance system is really going to be the primary option. So it just doesn't ask a lot of questions about various housing options that might be immediately available to someone. So that's all, that's sort of. It's
really housing options outside of shelter, I think, too, is what Norm is getting at. So not options that are available within the system, but options outside of the homeless assistance system, like friends or family, as you mentioned.
Right. So I should have been more clear. I'm talking about sort of permanent housing options that are not homeless assistance programs. The SPDAT tool certainly assesses for, and scores people for whether they should receive permanent supportive housing or rapid rehousing. That it certainly does. But it doesn't look at sort of the other housing options that might be out there that people might sort of, with a very minimal amount of assistance, be able to get, like reuniting with a family member, things like that. And again, it really wasn't designed to do that. And whereas the Canton Diversion Tool, I think, was explicitly sort of focused on answering those questions.
We have two people who are from Balance of State COCs, and this one's a little tricky. One person wants to know, should we ask if a client's willing to move potentially hundreds of miles to where their services are housing? Another person asks, should we tailor the assessment to what resources are locally available? So kind of two sides of the same coin there.
Yeah, I mean, the answer is yes. I mean, it's unfortunate that, and I know this is an issue in a lot of sort of larger states, that the service it's very important to inform people about what their options and choices are, and how they'll work, and to the maximum degree possible to give them as many informed choices as you can. And if that means some of your services are hundreds of miles away, and they could take advantage of them, then you should certainly make that option available to them if it's practical, if it's possible, I should say. And that said, I think this is something Kim, you did a nice job of reiterating at the beginning, is that we should be working on making the system work better for people too. And if you're finding that that's the option a lot of people take advantage of, then clearly there's a need to reorganize how some of your resources are located.
And what was the second question? The second one, I think, was just about do we tailor the assessment to what we currently have available? And I think that's kind of, I think that's one of the big things to think through with this whole assessment process, because you don't want to refer people to something that's not there. But I do think, again, you want to use the information you have to have better options available for people. So I think some of that does come down to just which is telling people the reality of what you have and seeing if that works for them. But I do think that you can, work within the system that you have, but at the same time, just keep track of the fact that your needs are not being met for what your system should have, basically. So it might be that while you're kind of building up this process and reshaping your system, that you only have certain things available. But I do think as you're doing these assessments, you want to be taking note of the fact that, well, we wanted to refer to this, and this seems to make sense, but we don't have it, and hope to use that to kind of build up momentum in your community to change things.
Great. We have a question from someone about how domestic violence sexual assault programs fit into coordinated assessment. Should they use the same assessment tools? Should they use different assessment tools that are more DV specific? And what tools do you recommend for this population?
That's a great question. And so I will say, I think that's a question that a lot of people are looking for HUD to answer and that they took comments on, and we haven't kind of heard the final results of that yet. I will say I know communities that are working with the domestic violence providers, and we certainly encourage that they work together to form a process. We know communities where the domestic violence providers do use the same tool as the rest of the system, and that seems to work well for them. Obviously, you need to think through the data entry, because that's not happening in HMIS, and how referrals are made in a way to keep data anonymous. And we do have some resources on that I'm happy to provide. I won't say that I think one way is better than the other. I think obviously the priority is that you are respecting the privacy of your survivors. But I will say it's important to think about this, the fact that there are a lot of survivors that are not going to go to the domestic violence agency right away, that are already coming through your system. So even if you're choosing not to work together for whatever reason, which again I encourage that you do, you should keep that in mind and have locations where survivors will be safe, have space set aside to assess survivors that want, a more private location. And I really think it's to the advantage of everyone to just work together and talk through what this looks like. It may be that you decide not to use all the same tools, and again, we'll kind of wait for HUD to tell us what needs to be done there, but you should definitely be talking about how everything's going to be handled, ensuring that survivors are getting connected to the housing resources that they need and not just domestic violence specific resources.
Thank you, Kim. I just want to say that I realize it's 3:01, but I think we're going to hang around for another couple minutes just to get through some of these questions we have here. So if you have questions still, you can feel free to type them in, but we have quite a number of them at the moment. So the next question is, should we evaluate if a consumer goes to or receives the service that they're referred to?
To evaluate if they are Can you say that one more time, Anna? I'm sorry.
Yeah. Should we evaluate if a consumer receives or shows up to the service or location that they're referred to?
I don't know that you're required to do that, but I do think that's a good idea, yes. And I also think along with that, you should be looking at, deciding if a person doesn't show up to wherever they were referred to, if it will be the coordinated assessment staff or the agency staff that follow up with them about that, if a follow-up is made.
So we have a question from a community, I think this is pretty common, that has a different coordinated assessment system for families and singles, and they'd like to know if it's important to have different assessment tools for these populations, and what should those assessment tools look like?
I think in general, if your system is already separate, then it's entirely appropriate to have separate assessment tools. You want your assessment tools to be sort of evolving and matching the needs of your clients and the services you have available generally. So I think it's fine and entirely appropriate to have different assessment tools or maybe different versions of similar assessment tools because you are serving different populations. If your system, however, is sort of a more combined system and everyone's going through the same portals, I think it's also fine to use the same assessment tools for everybody. But again, I think the tiering is the important part. So you wouldn't give a complete assessment to every person, but really look at assessment tools to help you make the next decision. And if people need more intensive assessment, then having those assessment tools that are really designed to provide more intensive assessment further on down the process.
We have one community that would like some advice. They have a lot of doubled up families on waiting lists for emergency shelter and transitional housing. And they'd like to know what kind of services they should be providing these families.
Well, this gets, oh, go ahead, Kim.
No, I was just going to say, I think that depends on where people are right now. So if people are doubled up and they're doing okay doubled up, I don't think that necessarily requires a lot of service provision, if any. I think what you can try to do is kind of provide basic diversion services, basically. But I think, if anything, we want to preserve their situations as long as they're safe for people to be doubled up temporarily. I think that can be a good temporary option for people, and for a lot of people, better than entering the shelter system. So, and I think, that's a good question to kind of talk through philosophically about what the wait list means, because if people are in a pretty stable temporary situation, do they need to be on a wait list for shelter? Norm, go ahead.
Yeah, this is a very complicated question, and I'll just give sort of a couple thoughts, but I think there's much more to this than I'm going to say here. One thing is that it's important to understand why someone is trying to access shelter. If it's because they have no other place to stay, then that's one thing. If there are particular types of assistance that they need that they can only get in the homeless assistance system, but not necessarily shelter, then you want to be able to identify those things, and you want to avoid having that situation where the only way a person can get assistance is by, or a certain type of assistance is by going to an emergency shelter. You sort of want to remove that situation if possible. But the main thing is you really want to just look at your data about what's happening to people while they're on those waiting lists. If most of them are not eventually entering homelessness and not are safe, and then you probably don't need to provide a lot of assistance to them, and you should focus on people who are currently experiencing homelessness to try to help them move on quicker, so that then that frees up more resources for people who need them in emergencies. If you're finding that the people in those doubled up situations are having huge problems, either because a lot of them are ending up on the streets, or this is a big problem in domestic violence, or things like that, then you really want to see if you can get some diversion or rapid rehousing type resources focused on that group to help them find a new and better living situation. So again, it's a very complicated question, and there's a lot to it, and but those are just a couple thoughts.
So we have two questions. One would like to know about the 2013 NOFA, which I'm not sure we have a lot of information about. And the other one is kind of similar. They'd like to, they point out that these coordinated assistance, coordinated intake can be very expensive, and if you could recommend funding strategies.
So the funding strategies are, Kim, you should add some stuff to it because I know you know how a lot of these programs are funded. But it amazes me the breadth of sources that people use to fund coordinated assessment. A lot of United Ways and foundations support coordinated assessment. Some people use HUD SSO, Continuum of Care, supportive services only type funding. Some people use resources like the Community Development Block Grant. Some people, take advantage of multi-service agencies that already do things that are similar to coordinated assessment. And, some people just, there are providers who sort of take on that role, and because of, the types of funding they have, they can, take on that task. Kim, you probably have some additional thoughts, maybe?
That covers a lot of it. I think some places, too, just like all kinds of different local and state funding that they've been able to dedicate to this resource. But I will say one of the things I found most surprising is that a number of communities that aren't necessarily getting or using additional funding, kind of to Norm's last point about providers, a lot of communities may have providers that are already kind of doing these services, and what's changing is just how they're coordinating them, but they're not necessarily adding anything. So it's kind of provider staff are still doing the assessments and kind of just making connections in a different way, and they're more coordinated way. But I think a lot of communities, because of the funding environment and maybe lacking some of those other sources that Norm mentioned, have kind of decided to work together as providers to make this work without having additional funding available at this moment. But I will say I think a lot of, when I do hear of new funding sources, it's typically what Norm mentioned, United Ways and the SSO funding.
Great. We have one person who'd like to know, what do you do if a client is turned away from a place that they're referred to, or intervention they're referred to?
So there are some communities that don't allow refusals. So, and I think that varies. Some communities, especially communities where they fund most of the providers, they've made that a provision of their coordinated assessment is that you're not able to refuse. Other places, I think Dayton is a great model for this, they allowed a certain percentage of refusals, but if you exceeded that or met that, then that triggered kind of a case conference between coordinated assessment staff that made the referral of the person from the agency who was refusing it and the person experiencing homelessness, and kind of said, okay, where else can you go? What other resources would meet your needs? And so I think that's a system decision that should be made as you're kind of putting this together, is if you're going to allow refusals at all, and if you are, what the process will be. But I absolutely think if you are going to have refusals in your system, there needs to be something so that that person doesn't fall through the cracks. So some kind of follow-up of, making sure there's some policy in place for what the next step would be in that situation.
Sorry, it seems like I've lost my questions box. I'm trying to find it.
That's okay.
If either of you want to answer any questions, please feel free.
So Kim, actually one of the questions that I get asked a lot about this is about the qualifications and training for assessment center, people who are doing the assessments. Can you talk about some of the things you've seen as far as how people, what level of training people have to do those assessments?
Sure. So I think it really varies, and it depends on what kind of staff you have doing assessment. So I know in some places it's social workers and case managers that are doing the assessments, and they often have training they're getting to their job anyway around how to ask questions that kind of carries over into their assessment work. And so a lot of the things that they'd be doing anyway, you see some kind of overlap with their assessment role. On the other side of that, I know that there are places where 2-in-1 staff are the kind of front line in terms of doing assessments. So they may get just some kind of basic training on like what questions to ask and what to do if they get a certain response. But we also know some communities that have actually had organizations that do really great work with diversion come in and train those 2-in-1 staff on how to do diversions, really beyond just, look for this question and this answer, but really kind of engaging people in a conversation. And in our last conference, we actually had someone from the Cleveland Mediation Center at Boyd who, him and his staff kind of do the diversion assessments in their community, and they're actually trained mediators, so they have that skill set already. So it can really go across the board, but I definitely think making sure people understand the diversion process, if you can, and kind of making sure they have those mediation skills is really great when it's possible.
And maybe we'll wrap up with sort of one last related question, which is, I hear a lot about the importance of the assessments being consistent. And can you talk about what kinds of things do people do to ensure that the assessment process is consistent across the system?
So that might be something as simple as kind of a site visit to different agencies. So I think this ties in a lot to how your system is governed. So it might be that your lead agency or your collaborative applicant is also kind of in charge of your coordinated assessment process. A lot of communities may have a committee or a subcommittee made up of different kind of community stakeholders that's in charge. But it may just be kind of going in and watching an assessment occurring and seeing how questions are asked or how responses are handled. I think it's also good to bring together different assessment staff on a regular basis and meet up and just talk through, are you having issues with a certain question, or is maybe if you're putting it into HMIS, is it, not if there's any kind of technological issues, or should the question be worded a different way. So I think it's kind of a combination of going into the agencies and seeing things happen and having assessment staff meet. I also think talking to people experiencing homelessness and doing some kind of survey of evaluation with them about how they felt during the process and what they were asked is another great way to capture that information.
Great. There are several other questions, so I'm actually going to just pull out a couple more and then we'll finish. One of the questions here is about the cost of coordinated assessment, and I think people are just sort of very interested in if you just sort of, what is the actual total cost of implementing a coordinated assessment system for a community, for a city of around 2 million people or so, or whatever size city. Do you have some suggestions for people about how they could sort of assess what the potential costs are, or maybe some examples of what what you've seen some assessment systems cost?
Yeah, so that's it's a little tricky. I think what it really comes down to too, there's so many other factors. For example, if you have multiple locations, if you have one, how many staff you use, how many trained staff you have, if you have a phone element or not. I really, unfortunately, I kind of balk at ballparking what a good number is. We have, and I can check to see if we can share this. I know for some of our projects, we've looked at a few different communities and kind of gotten examples of what those costs are. So I can certainly see if that resource, we can look at 3 different profiles, if that's something that I can share, if it's okay with those communities to help people figure that out. But again, I too, there are some communities that just aren't using extra money and are kind of relying on their providers to kind of pitch together. So I hate to kind of dodge the question there, but I just think I think it's really good to actually start to think about the model that you want before you start asking cost questions, just because deciding the number of locations and the staff can influence that so much.
Yeah. And then so one of the things that somebody has brought up that that we sort of talked about a little earlier is about sort of the degree to which providers who receive referrals from the coordinated assessment process can turn can turn people away. when they've been assessed to their program. So can you talk a little more about some of the suggestions for a community about what they should be doing to try to minimize that? Or I know in some communities there's it's just not allowed, while in other communities it's sort of allowed to some degree, and people use different strategies to get around that.
Yeah, so I think really this is part of a larger conversation that has to happen around coordinated assessment, around eligibility for programs. Because, and I think I mentioned this earlier, I really think that your coordinated assessment process can only be as inclusive and effective in terms of serving people as your programs are. So I think as you're kind of embarking on developing this and talking about your assessment and referrals and your technicalities of that, you also need to take a good look at what the different requirements are for entry for programs into your community. If there are things like income requirements, sobriety, things like that, and look at how that might affect who you're able to serve. And I say that because I think a lot of times the refusals are happening just because someone doesn't meet the requirements, and coordinated assessment staff didn't know that. So I really think the first step is for every program to write out what their requirements are for entry, and then as a system to come together and kind of look at all of those requirements and see, hey, how many of these do we actually need, and are there ways that we can serve people that we didn't think we could serve? How many of these are tied to the requirements of our funders or things like that? And also, are we screening out a specific group of people? Because I do think communities that have started down this road, and it's certainly not an easy one, but it is a necessary one, have found that some of the people that aren't getting served are often the people considered the hardest to serve, and it's just that people didn't realize that no one else in their system was serving them. So people with substance abuse issues, for example, people that are actively using, if none of your shelters will take someone that's actively using, you have to ask yourself, where is that person going to go? And then we're okay with the answer to that if they're not going to go anywhere. And certainly I'd hope you wouldn't be. And so I think that's something that is one of the more difficult aspects of this process, but really if you want to kind of prevent a lot of refusals and frustration, it's important to get all of that information out as soon as possible and attempt to make changes if necessary to make your system accessible.
And I think that brings up a very important point, and I think we'll sort of close on this, is the relationship between the coordinated assessment and your overall system and what you're trying to accomplish with your system. In too many communities, I think what coordinated assessment has become is sort of a coordinated eligibility determination for the various programs. And I think, that's really sort of missing the point of coordinated assessment. If people are not being served by any of your major program types, your permanent supportive housing, transitional housing, or rapid rehousing, because they have too many barriers, then that points to a very significant problem in your system that needs to be addressed. I think the promise of coordinated assessment is that it allows us to look at our whole population of people experiencing homelessness and prioritize those with the most challenges, the most barriers, the people who get turned away from other programs far too often, and to really think about your system as one that prioritizes in every case possible, prioritizes people who are most vulnerable, most likely to remain homeless. And I think that's really what you have to look at your coordinated assessment process to do, is not to be sort of a tool for screening people into or out of programs, but to be a tool for prioritizing people with the highest level of vulnerability and the highest level of need for whatever interventions your community has to offer, while at the same time looking at those interventions and really going through the work of transforming them into ones that are more consumer-driven, more effective, more efficient, more housing first focused. So with that, I just want to thank everyone who stuck with us on the call, even though we went well past our allotted time. Thank you very much. We will certainly be providing more information. We will, if you haven't visited our blog, we frequently post information about coordinated assessment there. We have a coordinated assessment toolkit on our website. These are all things that are pretty easily available either by Googling them or by going to our website at endhomelessness.org. We will send a follow-up email with some of these resources and a link to the archived version of this webinar. And again, I want to thank everyone for joining and thank Kim and Anna as well.